I am showing you two axial chest CT images of a young patient. Describe the findings.
The axial chest CT images demonstrate multiple pulmonary nodules with dense, bone-like calcification distributed in both lungs. Additionally, there are enlarged lymph nodes in the superior diaphragmatic and mediastinal groups that show dense ossification, matching the density of cortical bone. The surrounding lung parenchyma and pleural spaces appear normal.
Based on these imaging findings, what is your primary diagnosis and the significance of the density of these lesions?
The primary diagnosis is metastatic osteosarcoma, presenting with ossified pulmonary metastases and ossified lymph node metastases. The density is characteristic of true bone ossification, which matches the osteoid matrix production of the primary tumor.
If I tell you this 18-year-old male has a history of femur osteosarcoma treated with primary resection, how does this clinical history support and explain the diagnosis?
This history directly confirms the diagnosis. Osteosarcoma has a strong propensity for hematogenous dissemination to the lungs. The presence of ossified lymph nodes represents lymphatic spread, which is rare but classic for osteosarcoma metastases.
What is the clinical significance of lymph node metastases in patients with osteosarcoma?
The presence of lymph node metastases in osteosarcoma portends a very poor prognosis, indicating advanced metastatic spread.
Name 4 benign causes of calcified thoracic lymph nodes.
The 4 benign causes are tuberculosis, histoplasmosis, sarcoidosis, and silicosis.
How do you differentiate post-treatment lymphoma calcification from untreated lymphoma on imaging?
In patients with lymphoma, lymph node calcification is typically seen only after radiation or chemotherapy. Calcification is virtually never encountered in untreated lymphoma cases.
Name another malignant neoplasm that can result in calcified thoracic lymph node metastases.
Other neoplastic causes include metastatic mucinous adenocarcinomas, such as gastrointestinal or ovarian primaries, and metastatic papillary thyroid carcinoma.
Which specific lymph node group is involved on the second CT image, and what is its anatomical boundaries?
The lymph nodes involved are the superior diaphragmatic lymph nodes, which are located on the diaphragmatic dome, anterior to the pericardium and esophagus, draining the diaphragm, liver, and abdominal cavity.
Explain the typical presentation of pulmonary metastases in osteosarcoma.
Pulmonary metastases typically present as multiple bilateral nodules, which may show dense bone ossification, central necrosis, and occasionally cause spontaneous pneumothorax.
State the critical safety warnings and management recommendations for this patient.
The critical safety warnings are spontaneous pneumothorax due to necrosis of subpleural osteosarcoma metastases and rapid disease progression. Radiologists must immediately recommend referral to cardiothoracic surgery for aggressive wedge resections, suggest CT surveillance of the chest, and advise referral to pediatric oncology.